Good evening, ladies and gentlemen. So, Infermedica. We are a team of data scientists, computer engineers, and doctors passionate about the potential of artificial intelligence in medicine. So, let me ask you a question. Have you ever Googled your symptoms when you felt bad? The most popular answer would be yes. It has become a fact that people use internet to search for medical information regarding their symptoms. But what really happens when you use Google or even WebMD to search for, let's say, a headache? You get this long, confusing list of everything from common cold to brain tumor. And this actually can lead to misinformed or even harmful decisions, not even to mention anxiety. So we wanted to tackle this problem and give patients a tool to help them make better decisions and connect them with their healthcare provider. So the solution we came up with is a platform for insurers and health systems providing AI symptom checking for patients and the decision support for the providers. It is designed to ask intuitive questions, just like a real doctor does, accurately pre-diagnose, triage, and connect with appropriate services. So, our technology is highly customizable and white-labeled. It is also available in 7 different languages, including the top 3 of the world's most common. So, English, Spanish, and Chinese, and Polish as well. So, we position ourselves as a straightforward B2B company. Our goal is to be the best possible tool for other healthcare organizations. We already have a number of companies using our technology. Just to mention, Medicover Group Poland. Crossing the Atlantic, we have HealthLoop, using Infermedica in over 20 hospitals in the US. Currently, we're also starting pilots with 2 major European insurance companies, unfortunately undisclosed for this moment, but with a worldwide reach. We also have a different offering for a little bit smaller companies and startups, which is access to our technology for the API. So they can build their own products around sophisticated medical AI. Currently, we are a provider of the most popular symptom checker available, with over 1,000 users actively experimenting with the API and building some proof of concepts. Thank you.
I have a question regarding the quality of your diagnosis. So what happens if your initial assessment is wrong? So is there a threat of potential liabilities?
I was just backstage and it says I have cancer.
So what's the name of the app? Okay, so this is the most common question. And so there is a disclaimer at the beginning of every interview. We are not a medical device, and we're not aiming to be one for this moment. So this is for educational purposes. So we always recommend to contact, for example, a family doctor. We also inform you that the results of the interview are based only on the information you provided. So if you didn't say something, you can't blame the engine. But generally, there's a disclaimer that says, okay, this is for educational purpose. So it's always your responsibility what you decide.
Do you consider yourself a technology company?
Yes. We use sophisticated artificial intelligence, to be specific, Bayesian networks. So definitely, we do. Most of the employees of the company are data scientists and computer engineers. So, truly.
Do you have doctors in your team?
Yes, of course we do. We have a team of over 10 doctors working on a database on an everyday basis.
What's your revenue model? How do you bill?
So actually, our revenue model evolved. We started from a B2C app, which was free, and then was supposed to connect with patients so they can book a doctor, but it just completely didn't work. So we decided that, but we had attraction from other companies, like Medicover, who are interested in using the technology. So now we do customized deals with on the enterprise level, with mostly insurers and health systems. And they differ from deal to deal.
Or you could connect them to pharmacies in Mexico. They could just buy the drugs directly.
Sure, but this is a great idea. But this is something that you can do if you're, for example, an owner of some kind of telemedicine startup, and you get the responsibility for this Mexican drug.
It's very cool. Thank you.
Thank you.
Infermedica.